COVID-19 transmission patterns in Nigeria and support emerging information around the world to understand the burden of infection. This information will help inform decision-making around the response by Nigeria, the government, our state governments, our federal governments, and partners supporting the response. So, gentlemen of the press, thank you very much for your attention and your support. You have these figures already in your packs, and they will all get to your emails after the press briefing. Thank you as we continue to work together with all of you to respond to this outbreak in Nigeria. It's good to be back.
The chairman of the Presidential Task Force, our honorable ministers, members of the PTF, gentlemen of the press, good evening. So at the risk of sounding like a broken record, I'm going to talk about testing again, just like the honorable minister and the DG and CDC have prior to me. The PTF remains seriously concerned about the current low testing rates we have in the country. Nigerians are not getting tested for COVID-19, but we must test to track in order to slow the spread of the virus even further and to stop any more preventable COVID-related deaths. People all over the world are experiencing COVID fatigue. We're all tired. This has been going on for 7 months now in the country and almost 10 months globally since December. But unfortunately, while we are getting tired, the virus does not tire. It doesn't realize that we are getting tired. In fact, to the virus, this is an opportunity to spread. Therefore, we must sustain our approach because of the impact the virus has not only on our lives, but also on our livelihood. So for clarity, we are not convinced that we are flattening the curve. We can only be convinced, we can only confirm this, we can only know where we are with infection rates with aggressive testing. Currently, we are conducting, yesterday I believe we tested about 1,200 plus samples, even though usually on weekends we tend to have low rates any day. Anyway, but this is still quite low, well below our target. Our capacity as a country for testing is just above 10,000 tests per day. So you can see that this is clearly insufficient. We all have a responsibility to avoid a second wave of the virus, just like we're seeing in other parts of the world now. An increase in cases could result in additional restrictions. It could drag us back to where we were before, and this would have an adverse impact on our economy. We must therefore avoid a similar situation happening here. From our weekly polling, we understand that many people do not test for COVID for a variety of reasons. This might range from not knowing where to conduct a COVID test, being one of the primary reasons, to hesitation, to a fear, to the issue of stigma, and to the issue of shame with a positive result. Nigerians are just not confident of having a COVID test. But there's nothing to fear with a COVID test. If you know your result, you'll be in a better position to get yourself treatment and in a better position to protect yourself and your family, and as well as your loved ones. If you cannot find a testing center near you, there is a list of accredited laboratories that provide free testing published on the NCDC website, https://covid19.ncdc.gov.ng/laboratory, and we will make this available at the end of this press briefing. And just to re-emphasize, COVID tests in Nigeria are free unless you are testing for the purpose of travel. But they are free. No public laboratory is allowed to charge for testing at the moment. Private laboratories can charge you for testing if they are operating outside a state government arrangement. But if you need tests for COVID, you do not need to pay for it. You can go to any of the NCDC accredited public laboratories or the state laboratories and get tested for free. It's only if you are traveling, if it's a travel-related testing, in which case we would expect you to pay, and these charges only apply to private laboratories. At the moment, we are not allowing any public laboratory to charge for testing, whether it is related to travel or not. So we must get a test in the following circumstances, which the Honorable Minister of Health has already defined. This includes if you have symptoms, cough, fever, or difficulty in breathing. Any of those symptoms, you should really get tested. If you come in contact with a positive person, if you are arriving from abroad into Nigeria, and you must also consider testing where you have concerns, particularly if you fall within a vulnerable group, such as above the age of 60, or have a pre-existing medical condition, or you're looking after a very vulnerable person, and you have exposed yourself. Less than 50% of Nigerians have said that they will get tested if they were exposed to coronavirus. This, of course, is a very worrying number to us because it suggests that there might be a large number of people who may be positive without knowing it. If you believe that you cannot afford to pay for the test, please note that there are 69 laboratories certified by the NCDC throughout the country, and all of these provide free tests. We have released money to the state governments recently, to 32 state governments. Each state government was given ₦1 billion. This is for the purpose of driving their COVID responses. And we are asking them to please prioritize testing in addition to surveillance activities linked to COVID-19. We urge state governments to please publicize their sample collection locations so that people can access the tests. Lastly, if your friends, family, or colleagues have a pre-existing condition, they are vulnerable and at a greater risk. It's important that people within the vulnerable groups realize that at this point in time, more than at any other time during the epidemic, they are most at risk of catching COVID. Even though the number of cases are going down, but compliance with non-pharmaceutical interventions is quite low, and therefore the risk of transmission to vulnerable people as we all come out is very high. They need, if you fall within the vulnerable group, you need to protect yourself. Just because the epidemic, the numbers are going down, doesn't mean that the virus is any less virulent. For those who test positive, our message is there is no shame in a positive result. And this also applies to state governments that at the moment are not testing enough. Those silent states mentioned by the DG NCDC. We should consider it a civic duty to inform those that we have been in contact with if we happen to have COVID, and urge them to also get tested. Regrettably, over 1,000 Nigerians have died as a result of the coronavirus. Some of us have had personal losses, and the pain of this loss remains, as they are survived by family and friends. To all of us who have lost a loved one to this disease, we urge you to please educate those around you. Test to protect yourself. Test to protect your loved ones. Thank you.
Mr. Chairman, members of the PTF, ladies and gentlemen and ladies of the press, good evening. From the Federal Ministry of Environment, we will be bringing you up to speed on some of our planned activities that will be in the subsequent briefings. Today, I just want to say a little bit about advocacy in terms of adhering to the protocols and guidelines, especially as it pertains to travel. As you have noticed, I have been away for almost a month now. I went to US, and let me tell you that PTF here is doing a great job, not because I'm a member, but you know. Because in other countries, they don't follow any serious rules. So here it is. The rule says when you travel, upon coming back, 1, you conduct a test outside of the country. You come in with a negative test. I have done that. 2, when you come in, you isolate for 7 days. On the 8th day, you take another test. I have done that. And then 3rd, you now can join when your test is negative to the rest of the population. If it's positive, God forbid, of course, treatment center. Why do that? What is the benefit? 1, you have peace of mind that you know you are clean, you are okay. 2nd, you know you have protected your family from possible danger. 3rd, you have protected your country, men and women, again, from possible danger. And 4th, you have demonstrated the responsibility that we said we must take responsibility. This is the only way that our numbers will continue to go down as it has been going. We have been doing decently well, but we still have a long way to go. Just as the chairman has explained some of the relapses in other countries. I'm not going to go too much into that detail, but it's all about taking responsibility. You have everything to gain by adhering to the protocols, especially when returned from a trip. So I'm happy now. I know I'm okay. I have not exposed anyone to any possible danger. The rest I will speak in Hausa, of course. Jama'a assalamu alaikum. Yau zan ɗan yi bayani ne akan 'yan abubuwan da za mu yi a ma'aikatan muhalli ta ƙasa, amma ba a yau ne za mu yi ba, sai dai nan gaba zaman da za mu yi na gaban Allah yadda. Amma yau ina so in bayani akan ƙarin bin ƙa'idoji, musamman idan mutum ya fita daga ƙasar nan ya je wata ƙasa yana dawowa. Ƙa'idan shine ka tabbatar ka yi gwaji na cutar corona kafin ka shigo da takarda shaidan cewa ka gwada kuma baka da ita. In ka shigo ka keɓe kanka ko ki keɓe kanki na sati guda, a kwana na 8 mutum ya sake gwadawa. Allah ya sa babu, shikenan ka shiga jama'a ka ci gaba da harkanka hankalinka kwance. In kuma wani abu ne daban, in akwai ne, duk da haka ka gano da wuri kafin cutar ta ci ƙarfin mutum ya je wurin magani. Me amfanin yin wannan? Na ɗaya dai ka san cewa baka da ita, hankalinka kwance. Na biyu, ka kare waɗanda ka sani, ka kare mutanen ƙasa, ka kuma ɗauki nauyin yin abin da ya dace don ganin cewa baka yaɗa cutar ba. Cutar nan jama'a tana nan da sauranta, kuma jira take kawai ka cire silkenka ka aje ta ram da kai ta kama ka. Akwai silken ku ba na bane duk waɗannan ƙa'idojin da aka ce abi, da sa takunkumi, da wanke hannu, da rashin shiga a manyan taruka, da abubuwa makamantan haka, su ne za a ci gaba da yi har ila yau. Duk da yawan cutan alaman tana raguwa ba ta ci gaba, to mun ga waɗannan ƙasashen da suka yi zumbur suka buɗe, suka shiga sheƙe ayarsu da cin karensu ba babbaka, ganin ta ragu. Kafin a ce haka ta dawo. Yanzu gashi nan ƙasashe daga cikinsu akwai Faransa, akwai ƙasar Andalusiya wato Spain kenan, akwai ƙasar Israel, duka yanzu sun fara komawa dokan zaman gida, ganin cewa ta abin nan suka yi sako-sako da abin. To kada mu zama cikin waɗannan da za a shiga ruɗami, a ci gaba da yunkurin bin ƙa'idojin nan da dokoki. Wannan shine zai sa mu ta sake ta gaba, ta san inda dare ya mata, kafin har Allah ya kai mu lokacin da za a samu rigakafi. In ba a samu rigakafi ba, duk wani abu da mutum zai yi fa, to abu ne kawai dai na wucin gadi. Saboda haka mu ci gaba da kiyayewa da karewa, mu kuma tabbatar cewa mun ci gaba da tunawa da cewa tsofaffi ko kuma waɗanda suke da waɗansu cututtuka da suke damun su suna kan gaba wajen kasancewa cikin haɗari. a guji kuma kusantansu musamman yara matasa da za su rinka zuwa gurin kakanni da dai sauransu. Wa'annan su ne duka za su taimaka wajen tabbatar da cewa wannan cuta in Allah da nan ba daɗaya ba ta tafi. Mun gode.
Thank you, Honorable Minister of Environment. We have finished the updates. We will now switch to the question and answer session. Are we ready with your questions? Yes, sir. Okay.
Good evening, Honorable Ministers, my colleagues. My name is Friday Okerigbe. I'm a reporter with Channels TV. I would like to direct my first set of questions to the National Coordinator. It has to do with the international travelers' guidelines, especially as it has to do with the generation of the QR code. There is still a lot of complaint from intended travelers that they are unable to generate the code, which of course has to do with the inability of them to pay online. I know that the PTF has said that there is a provision to allow people fly without the code, provided they've tested negative for COVID. But it does appear from the complaints we had, especially yesterday from UK, it does appear that many of the airlines are not willing to take passengers on board without the QR code. Perhaps they are afraid of the penalties that were announced, that if you default, you will be fined as an airline when you get to Nigeria. Is there anything that the PTF can do about that? I know that you've made an announcement that people can travel without the QR code, the QR code. Then secondly, regarding that too, there's also a lot of concern about the cost of testing, especially as it includes minors. The lady who called in yesterday actually complained about a minor who is less than 4 years, and they said, they insisted that the minor should also pay the above 50,000 naira when converted. And the question is, can minors and children be exempted or be considered to pay a lesser fee? Then the second question is a bit technical. I would like the DG NCDC to respond to it. We know that there's been much explanations to some of the reasons perhaps why some persons are no longer willing to test for COVID. But I was watching a documentary about Sweden some time ago, and the state's health officials in that interview explained why from day one, Sweden adopted a no-mask policy. And one of the explanations they gave in that interview was that they knew that when the majority is exposed to the virus, it will build a kind of immunity. There will be a level of resistance to the virus. And in that interview, the health official said that is the reason why they have recorded low fatality and even low cases, because the few who were exposed to the virus initially were treated, and many of them have developed some level of immunity. Now, my question is this. Is it possible, too, that here in Nigeria, there are lots of persons who have knowingly or unknowingly been exposed to this virus, and they've been treated somehow, and then they've developed immunity to it? Thank you.
Good evening, Rachel Abuja from the News Agency of Nigeria. And my first question is for the WHO rep. So I would like to know, or Nigerians would like to know, what is WHO's opinion on time-saving testing method known as pooled testing, which is involved in combining small amounts of all swab in a batch into a single test tube. My next question is for the coordinator, sir. Sir, from a public health approach, how can Nigerians get prepared for the post-pandemic mental health crisis? And welcome back, the NCDC coordinator. Sir, the situation of the pandemic in Nigeria is grossly affected by poor return in samples and collection and testing as well, you just mentioned. Now, this has truly given us like a largely deceptive pictures of our curve, which we all know, and thank you, you said it earlier. Now, what parametric step is being taken to work with those states being mentioned, and what should Nigeria be expecting from that? Now, to the SGF, sir. In July, you were with Khan, so to say, and you actually explained what COVID-19 was, and you took your time to explain further the need for everybody while going to church, mosques, and all to wear face masks. Now, for my investigation, a lot of religious institutions don't enforce that anymore. I would like to know, and which we all know there is a potential crisis at hand, what will you be doing differently this time? Do you still have your relationship with, or your partnership with the religious leaders, or will you be calling them back? Thank you very much.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News, and welcome back, DG NCDC. And my first question actually is for you, and it has to do with the people who are isolating at home after testing positive for COVID. Are they mandated to have a test done after they recover? We need that clarification from you. And also, I know that your agency has actually released some sort of statement as it concerns what the Honorable Minister of Information has on his outfit, the Air Doctor. Nigerians want to hear from you how effective it really is to prevent you from getting COVID-19. And my next question actually is for the National Coordinator, Dr. Sani Aliu. There are lots of concerns, especially as it has to do with travelers into or out of Nigeria. First things first, for those who are coming into Nigeria and have been able to pay for their retest in the country, and for some reason they have to travel from the state where they picked, is there a penalty to switch to a different lab in a different city? We need that clarification. And also, this is a major concern. This is a personal experience I actually followed through during the weekend. It has to do with an individual who is supposed to travel back to his place of residence. And he had a test done in one of the private labs. I will not call the name, but I can speak to you privately about it later on. And he was called and told that he tested positive. But if he wants to give them some money, they can switch it. And this is an individual who eventually, I encouraged him to go through our public labs. And guess what? He tested negative. So my question to you right now is, can he use that negative result from the government facility to travel, especially since they had already paid to that private lab? So we need that clarification from you. And to the SGF, sir, we keep talking about testing going down and the fatigue. States are not testing, but my concern is still Kogi State. I know that there is a molecular facility in Kogi State, yet we're not using it. We know these things are not cheap. Your position as the chairman of the PTF, as well as the secretary to the government of the Federation, what are you going to do differently to really help encourage you? The DG has set up the molecular laboratory, but the governor is not testing. But we need to do this test to know what we're really dealing with in the country. Those are my questions. Thank you.
Good evening, Chairman and members of the PTF. My name is Mitaire Ikbe, and I report for the NTA. My first question is to the Minister of Health or the DG of the NCDC. The PTF, as it were, is now indicating that the declining number of COVID-19 cases in the country is proportional to the declining number of tests being done in the country, which has dropped from 40,000 to 20,000 per week currently. What is the PTF doing to step up testing? Is the PTF engaging the states enough to ensure that they test? Or we are just going to sit down and wait till the tests drop to zero? My second question is for the National Coordinator of the PTF, it is indicated in the guidelines for this third phase of eased lockdown that the NYSC should prepare to reopen orientation camps as soon as schools reopen. So with the reopening of schools at the moment, what is the status for the reopening of NYSC orientation camps and the other aspects of the scheme? Then my third question is for the PTF chairman and secretary to the government of the Federation. A lot of recruitment exercises, several recruitment exercises were stalled prior to the lockdown and as a result of the lockdown. What is the plan of government to continue with those recruitment exercises, as a lot of young Nigerians are waiting to know? Thank you very much.
Thank you. We have taken all the questions and we'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, and the WHO country rep before we invite the chairman of the PTF to the podium to round it up. We'll begin with the Honorable Minister of Health, followed by the DG NCDC and the National Coordinator, before we take the country rep. Honorable Minister.
Thank you. There is just one question for the Ministry of Health, and that is in respect of the testing. The testing capacity we have now is very, very commendable, I would say, but it's being utilized to about maybe 35% or 40% at best, which means it's not being fully used. In order to do that, and by the way, we have well over 80 laboratories that are functioning now. In order to do these tests, you need to have the samples, and the samples are taken at the state level by the functionaries of the state government or local government, or who works with the ministries, of state ministries. Now, these samples should be brought over to the laboratories for testing. And if something doesn't go very well there, either it's too slow or it didn't happen at all, then we have this hiccup that you don't get enough samples. Now, there are people who have spoken of fatigue, of complacency, of people who are being tired of. We don't know exactly why, but what we resolved just this morning at the Ministry of Health is to get a senior director who will go and pay advocacy visits to the states and engage the governors, particularly those ones who are not doing what we think they should be doing, or they're not doing that well enough, to engage them and just to remind them that we are not yet out of the woods. This country is still threatened, and we need to be able to know our status by doing necessary testing. I have myself also done that in meetings I've had with the governors. There are some have expressed their problems. One has said that if they test, they didn't find any, so what should they do? Or another one asked what kind of yardsticks. They can't go out to the street and be taking sample from everybody. What kind of yardsticks, what kind of symptoms should they look out for? So that's why I repeated those symptoms again today, so that if you have people in that category, you can take samples and send. So we have to do advocacy at state and local government level. We have to also urge community leaders to try very hard to increase the pace of testing. The laboratories are there. Some of them are not even carrying the number of samples that they can carry. So that is, and therefore it's not efficient. And we have even thought of shutting down certain laboratories because it's a waste if they're not doing their working to anywhere near their capacity. So we hope we can remedy that with time.
So thank you, gentlemen of the press. It's almost like we never left. The questions are very similar, but the issues are still similar. On Sweden, Friday, I think we've gone over this quite a bit. Sweden took a different approach from many other countries, so they never really locked down fully. But you need to really understand Swedish society or the Scandinavian countries in order to make these comparisons. The countries where people already, when you say we should stay 2 meters apart, they will say, why so close? Right? These are countries where people are apart anyway, most of the time. But having said that, the numbers from Sweden are actually nothing to be proud of. Their numbers in comparison to other European countries are actually not too comfortable. They have had worse numbers than many other countries in Europe or around them. So, you know, the whole thing about herd immunity, i.e. allowing people to get infected, no country will resort to herd immunity as a strategy. It's something that happens if it does happen, but the consequences of having that type of strategy means that you're going to say it is okay for certain people to die. And it's not something we can do. So it is a conversation that will continue to happen. Our Sero survey will start telling us about the amount of infection in Nigeria, from which we can start drawing some conclusions over the next few weeks and months. But we'll continue looking at this. Someone that was looking at these various countries said, in between, right now it's a very difficult time to say which country has done better than the other. We need to look at the outbreak in about a year's time to define which countries have really done better with their control strategies. And at that time, we may not be putting Sweden as high up as we have at the moment. Rachel, you said something about the point you're making about sample collection and testing, and if it's giving a deceptive picture. I wouldn't say deceptive. I would say that the picture is different in different parts of the country. So I think in Lagos, I'm fairly confident about the numbers in Lagos because they've been testing consistently high numbers of people throughout the period, even up till yesterday. So the numbers from Lagos are consistently high. So if you test high numbers and you see your positivity reducing, then you're confident that the results represent the reality in your state. And it's in the same in some other states. But the other states, they're simply not doing enough. So when we report these numbers as a national figure, I want us to always remember that, you know, it's not one collective box. These are really small boxes linked together in a country, and each box represents a state. So we really have to look at what is happening in each of those states. Unfortunately, these platforms are not appropriate for us to start giving data for each of our 36 plus 1 states separately. But if you want to do any in-depth analysis, it's better to look at it at the state level. And if we look at it at state level, I'll say, listen, I'm fairly confident of what is going on in Lagos, FCT, probably Kano, and a few other states. Having said that, it doesn't mean that you know, they should let down their guards completely. In fact, with schools opening, airports opening, we have to increase our level of attention because inevitably there will be more transmission as schools open because you bring people together. So it's how are we able to mitigate the impact of that moving forward, given that we have learned so much about this virus over the last few months. Amaka, I think you asked about the isolation at home. Whether you're isolated at home or in isolation centers, our policy is that after 14 days, if you're asymptomatic, or after treatment and 3 days of being asymptomatic, when you recover, you can be discharged. You shouldn't be tested again. It's a waste of tests, actually, because it is not required. We now know that 14 days after your infection, even if you find fragments of a virus, you're not infectious. I know some people find it difficult to understand and implement, but that is really what the science shows, and there's no ambiguity about it. It's not a Nigerian policy, this is a global policy, best practice around the world. Yes, we did release a statement about the air doctor tag, but if you read our statement carefully, we said if you want to wear the tag, we're not in the business of stopping people from wearing tags. Please wear your mask in addition to the task. And as you can see, the Honorable Minister for Information is dutifully wearing his mask. So we haven't found any extra benefit of the tag, but it doesn't cause anybody any harm. So our role is not to stop people from wearing what they want to wear, as long as they're carrying out what we do advise, which are to wear masks, to distance, to wash our hands, and to do all the other things. So thank you very much.
Okay, I think I have a fair number of questions, so I'll try and whiz through fairly quickly. So the first one has to do with generating the QR code. So we've done a lot of work on the portal over the last few weeks, and I'm pleased to say it's actually working well now. More than 90% of passengers in general are able to get onto it and make a payment. There are three things you need to do when you get onto the portal. The first one is you need to fill your health questionnaire. The second is to upload your COVID-19 negative PCR result. And then the third is the payment side. So what we've done is we've created a button if you are unable to pay, provided you have filled your health questionnaire, provided you have uploaded your COVID-19 PCR. There's a button at the top which says generate a QR code, and you'll be able to generate a QR code. And that barcode will come with a statement saying you have not paid and tell you the repercussions if you haven't paid and you've boarded. You will still be allowed to board because that QR code will say that you will be allowed to board. However, when you arrive in Nigeria, there will be a potential delay of 2 hours or more because you haven't got all the paperwork you need to have to exit screening fairly quickly. And then secondly, you still have to pay. And that payment may be at the airport or it may be at the banks, because eventually if you cannot pay at the airport, we're not going to detain you. No, we will allow you to go home, but we will still expect you to pay at the bank before day 7. So we've done that, and in fact we've issued an all operators letter through the DG NCAA, I believe over the weekend, and it says quite clearly that having a QR code is strongly recommended. However, it's not mandatory. It's strongly recommended because the more people having the QR code, the faster it will be for us to clear people and avoid congestion at the airports. And we also need to stop this process of having paper when it comes to screening, etc. We need these forms to be available and filled electronically so that they can be saved and accessed easily. If we have a passenger with a positive COVID result, it would be much easier for us to go back into the system and have a look at the COVID PCR result that the passenger has uploaded before boarding to see whether does it look genuine, if there are issues with it, etc., rather than going into thousands and thousands of paperwork to try and find out which one belongs to the passenger. The cost of testing. So we've got exclusion groups. Minors below the age of 10 do not need to pay. They don't need to pay. So this issue of paying for a minor does not even arise. The cost that we arrived at for FCT, as I keep on saying, it's the state governments that we expect to do the negotiation with the private laboratories. For Abuja, the negotiation was done with the FCT. For Lagos, they already had a portal and they did negotiation with the laboratories. Lagos had 11 laboratories. Abuja, at the moment, we have 5 laboratories on the system now. The more laboratories we have, the easier it will be to push down the cost. And more importantly, for the Abuja laboratories in particular, they have a responsibility of making sure whether if you arrive Abuja and you go to Sokoto, they have a responsibility of making sure that you are sampled wherever you are in the country. So that in itself adds a further cost to their logistics. And that's why we are encouraging state governments across the country and private laboratories to open up across the country so that passengers can have choice and we can push down the cost of testing. The other issue had to do with switching to a different lab if you happen to leave Abuja. So wherever you are in the country, if you have paid, you've already paid for the lab to do your test. It is no longer your problem, it's the problem of the lab to make sure that you are tested, because you've already paid them for the service. So if you have already paid for the service, why on earth would you go to another laboratory to have another test? If there's an issue, call the lab. And if you cannot reach the lab, let us know and we will take action. You have up to day 14 anyway to do the test. We prefer you to do the test day 7 so that you can exit quarantine day 8 if you are negative. If you don't do the test day 7, we don't want people to exit quarantine until they know their status, their infectivity status. But you have between day 7 to day 14, wherever you are, to do the test, but you've paid for it already. And it's the responsibility of the laboratories to test wherever you are. Now, this issue of somebody having a positive result and then negative, give me the details and we'll take action on it. We will not tolerate any situation where a test, for whatever reason, is either faked or people are giving money for the purpose of having a result of their choice. We will not tolerate it and we will take action. But yes, the person can test outside Abuja, as I keep on saying. Yeah, wherever you are, you don't need to stay in Abuja or Lagos in order to have the test at day 7. And then Rachel, you asked about the issue of mental health. Yes, so definitely with COVID, a lot of the after effects have to do with developing symptoms very similar to post-traumatic stress disorder, especially those that have undergone intubation and have been in intensive care, etc. And it's really important that we continue to rehabilitate them. I know there's a piece of work with the case management team in the Federal Ministry of Health. They have linked up, I think it's with the Federal Medical Center in Jabi here, and they have a team that they are linking up with. Whatever is the case, it's important that as we recover from COVID, we strengthen our health systems, whether this is going to be in mental health services or in any other part of the health sector. It's really important that we learn from COVID and make sure that we recover as quickly as possible. But yes, there should really be special mental health services for people who have suffered from COVID. There's no doubt that it's an awful thing, both for the patient as well as the relatives. So in terms of NYC, yes, you're quite right. We said NYC should prepare to open up their orientation camps. I'm sure they are already working on this night and day. One of the things we plan to do with NYC is to push up testing. We will be looking at testing within the orientation camps. I'm not aware that they have fixed a date yet for opening the camps, but we look forward to it and we'll work with them closely to test as many corpus as we can. Thank you.
Question on pool testing. As you know, WHO has issued the recommendation of testing for COVID-19. There are 2 types of tests. The one that can detect the material from the virus or the proteins, and the other one that can detect antibodies. But I believe the question was about the test that detect the material from the virus. The recommendation from WHO, the guidelines are clear. They are based on testing each individual to know whether he has been is harboring the virus through detection of genetic material from the virus. I know that some of the laboratories, for various reasons, and mostly when they are faced with issue about reagent and they have to rationalize use of reagent, they try to pull sample from several individuals and test them to see whether any virus material can be detected at all. And based on that result, they will then process individually to know which one, from which individual those material come from. But WHO guidance on that is whatever the method, the testing method the country chooses or lab chooses, it has to be assessed for its actual sensitivity or specificity, its ability to really detect the cases, the infectious cases that are in that batch. But as for WHO, we recommend that testing be done following our guidelines with the PCR as a gold standard. So that's what I can say for WHO position regarding pool testing. Thank you.
Okay, we've taken all the responses, and we will now invite the chairman of PTF to answer the questions directed at him and to round it up.
For Rachel, we'll continue our engagement with the religious bodies. We've been doing that, and we will not abet. I'd spoken about the issues of exhibition of reckless confidence when people gather and they do not think it is appropriate to wear a mask. All we can do is to continue to appeal to our people and drive home the point. The COVID-19 is still alive. It has not gone on any vacation. It's not relaxing. And in my statement this evening, I did mention that it just took 4 days for us to get from 30 million infections in the world to 31. Just 4 days. And these are people. They are not just statistics. So as much as we are not seeing the figures reflect in our country, it does not mean that infections are not going on. There are. People are dying on a daily basis from COVID-19. The high, the mighty, and the low are dying. So it's a very serious issue. And I keep saying this, that as we expect the vaccines to show up on the horizon, the only vaccine we have in our hands now, let's apply it. And the only vaccines we have are the non-pharmaceutical interventions. There's no cure. And the best we can do for our people and our country is to adhere to these non-pharmaceutical interventions that have been put in place. Wear your mask. Observe social distancing. Stay away from large crowds. And if you have no business, don't travel. That way you keep yourself safe. And by extension, keep your family and your loved ones and your entire community safe. So we'll continue to appeal to our people in places of worship to ensure that they insist on members of their congregation wearing masks, either in the mosque or in the churches. And we'll continue our engagement with our spiritual leaders and our traditional leaders, because we've ceded the risk communication to the communities now. We would oftentimes remind them at this level, but it is primarily the responsibilities of the subnational authorities and traditional institutions and religious leaders at our communities to drive home that point. Yes, Amaka, yes. I don't know what testing facility they have in Kogi. Either it's a molecular laboratory or the gene expert machines. Whatever it is, they are meant to conduct PCR tests. You have seen from the statistics that are coming out on a daily basis, Probably yesterday, there are only 12 states, Chukwe, I stand to be corrected. There are only 12 states that reported. We don't have 12 states in Nigeria, we have 36 states plus the Federal Capital Territory. So you can see that we're under testing. There's no doubt about it. If only 12 states are reporting, we'll continue to appeal to the subnationals because it is their primary responsibility to provide for the welfare and the care for their people. And this is part of it. We've done everything that we need to do from the federal level. The president has graciously approved for 32 states, or 34 states, you can say, 1 billion naira each. In the federal budget to help with their response to COVID-19. Lagos got 10 billion naira, Kano got 5 billion naira, and the other states, the 34, got 1 billion naira. And we had in place processes and conditions on how to access that. And all is driven towards the national response. So I don't think any state can complain about lack of logistics now for not testing. The World Bank has also supported. Most of the investment of COVID went to the states, not the federal. In terms of provision of testing facilities, in terms of provision of palliatives, in terms of provision of everything you think about in our coordinated national response. They are in the states. The same thing with the interventions that we got from the NMPC and its partners. Where are they? They are all in the states. So I do not see any reason why states would not. I understand the issue of fatigue. Everybody is tired. All over the world, it's not only in Nigeria, everybody is tired. Because the entire world has never gone this way. We've never gone this way. We've never experienced such a pandemic that has lasted this long. 7 months we are on the same thing. We've thrown trillions of dollars on COVID-19. It's not abating. It has refused to go. So it's not even about money now or the provision of infrastructure. We have bed facilities now that we are thinking about closing up certain isolation centers because there are no confirmed cases that have reported in those places. So much of investment has come into this. But the virus has refused to respond to our investment. The only investment that we have in our hands to deal with the virus now is to adhere to the non-pharmaceutical interventions. You can throw 10 billion at COVID. One COVID, you throw 10 billion at it. It will defy that 10 billion and get you infected if you do not do the proper thing you're supposed to do. So it's not about money. The entire world resources, every country has arrested its budget, 2020 budget, and diverted it towards dealing with COVID-19. Even the major economies of the world. The whole of the Congress in the US is talking about stimulus. Stimulus towards what? Towards COVID-19. So we are dealing with a situation where the response of the citizens of a nation will determine the outcome. You see, we have a society that must step up. I'm glad that's one of the reasons why we are asking the president to launch the national ethics and integrity policy during these processes of our celebration. Because as a people and as a country, there must be a paradigm shift in the way we apply ourselves and do things. We must take responsibility for our lives. I heard Rachel referring to Sweden The Scandinavian nations are slightly different. Slightly different. And like Dr. Chikwe rightly said, no country can afford, as a matter of policy, to say we have decided to wait for herd immunity. No country can do that. So I believe that we'll keep appealing to the subnationals to ramp up their testing. We shouldn't be reporting only 12 states in a day. There are 36 states in Nigeria with the Federal Capital Territory. So there are 37 territories that are supposed to report on a daily basis. For now, there is nothing as important as COVID-19 in the entire world. So that whether we want to wish it away or pretend it's not there, it's not the issue. Elections in particular countries are going to be determined on the responses of the leadership to COVID-19. So it's not a small joking matter, it's a very, very serious matter. And I believe that our leadership at the subnationals would get more responsive to these matters. Mitare, you asked about recruitment exercises being stalled. Recruitment exercises have guidelines, and there are processes of approvals at different levels. An agency can decide to embark on a recruitment exercise. It has to seek for validation of those processes from different organizations. One of it is even the Federal Character Commission. Before you recruit as an agency of government, they want to know whether there is equity in the processes that you are putting in place. And all parts of the Federation will be represented in the course of that recruitment exercise. So because of COVID-19, everything has been juggled. Even the staffing in those organizations to be able to undertake this exercise, we're still at level 12 and above. So there are a lot of constraints that have accounted for why recruitment exercises have been slowed down. Issues of proper processes and manpower, I believe, is affecting that exercise. Well, the truth about it is that we've gotten to a point where, as a nation and as a people, we have to be extra vigilant. Why? Because we can see what is happening in other climes, in other jurisdictions. Some countries that we thought had dealt effectively with COVID-19, they are beginning to witness a resurge. Nobody can explain it. They have been regimental even in the enforcement of the non-pharmaceutical measures and closing down of their borders. Some of them are total islands that for a very long time have not allowed people coming into their countries. So, as we are opening up our international airspace, we are receiving deportees. Schools are opening, and schools have been established as major centers of infections. We have to be very, very vigilant and careful so that all the gains that we've had in the last 7 months will not be eroded. And the only way we can secure our people and make sure that these gains are not eroded is to insist and prevail on each and every person to ensure that they comply with the non-pharmaceutical measures. Some friends came to my office over the weekend while I was working and asked me, I had my mask, I had my shield on, I have my shield on the table. When a visitor is coming, I pick it up and I put it on top of the mask, and I have a glass screen in front of me. And they felt that it was being overprotective. I said, I have every reason to be overprotective because for now, I don't have any other remedy in dealing with COVID-19. Thank you and good evening.
Thank you very much, Chairman, PTF on COVID-19. That brings us effectively to the end of the national briefing for Monday, 21st September 2020. As a quick reminder, we have a few points for you to take home. Until today, we did not realize that 60% of the management of NCDC, the major focal agency supporting the national response, is made up of women. And glowing tributes has been paid to our women working in the NCDC. And indeed, all women in Nigeria, we thank you very much. Without women, national development is stunted, and we acknowledge you. Our numbers might be declining, but we must remain vigilant and careful until we are able to test in sufficient numbers across all the states of the Federation. It requires that we work together. We cannot jubilate at this point. Our response, the response of all our citizens, remain very critical, and we must step up our testing. We have also been informed that household seroprevalence survey will commence in Gombe, Enugu, Nasarawa, and Lagos states. This is to support a better understanding of the spread of the virus in Nigeria and to improve our national response. We have been told this evening that we do not need to be afraid to test positive. Knowing the result will help us to get treated and to protect our loved ones. We also appealed to subnationals to prioritize testing because that is the only way to address this pandemic. For those that are traveling, we have been told that if you are unable to generate your PR code, you will still be allowed to board, but you should be prepared for some delay at the airport because the PR code and the printout will facilitate seamless movement at the airport, but you will not be detained at the airport in Nigeria. For minors, please, all Nigerians should note that minors below the age of 10 do not need to pay for tests. For mental health, we have been informed that special attention is being paid to mental health of patients, their relations, and medical workers. I want to thank you. God bless Nigeria. We hope to see you on Thursday by the grace of God.
From dusk to dawn, 24 hours a day, NTA International is with you in your living room, office, everywhere and anywhere. We provide the company you desire in terms of balanced and